Begin with hand hygiene. Don clean, non-sterile gloves. Assess the port area, looking for signs and symptoms of infection, and ask your patient if he's had a fever or chills. Palpate to locate the Mediport, specifically the septum. Next, you'll gather your supplies. The items you need are a sterile port access kit, a cap, a Huber needle, and 3 saline syringes. Begin by opening your port kit. Remove the sterile gloves and set off to the side. Apply the mask. With the clean drape, drape your patient. Carefully remove the chlorhexidine swab. And scrub the site. Remember to use a basket weave pattern. Back and forth, up and down, and diagonally. Be sure to scrub about 2 inches around the Mediport site and make sure that you're scrubbing for 30 seconds. While the chlorhexidine is drying, you can prepare the rest of your materials. Open your saline syringes. And prime the cap, opening only the blue end of the cap. Carefully attach the syringe and holding in an upright position, prime until you see saline. This is its own sterile field and it can be placed anywhere you can reach it. Next, we're going to prime the Huber needle. You want to look for the side with the white cap and try and move that around and get it to the open here side. Remove the white cap. Attach another syringe and prime till you see fluid. Carefully place your syringe in your sterile field. Remember, the syringe cannot go in. The Huber needle must remain sterile. The third syringe just gets placed outside of your sterile field. At this point, we'll perform hand hygiene And we'll apply our sterile gloves. I like to prepare my dressing while both hands are sterile. I put all the gauze in one stack and tape just the edge of the gauze. And turn it over so it doesn't stick to my sterile field. Remove the needle guard with your non-dominant hand. Secure the Mediport. With your dominant hand, access the septum. 1, 2, 3, poke. Using your non-dominant hand, aspirate for a blood return and flush in your saline. Using only your sterile dominant hand, apply the dressing over the Mediport site. At this point, it becomes a clean procedure, and you can use 2 hands. Securely tape all 4 sides of the gauze, forming an occlusive dressing. Draw off your 5 mLs of waste. And clamp your line. Remove the syringe. Attach your vacutainer. Following the order of draw your labs. Aspirate tubes gently. Using the syringe without the cap, remove the vacutainer, apply the syringe, and gently flush the line. Clamp. Apply the cap. Flush the remaining 10. Remove the syringe and then clamp. Be sure to label the tubes in the presence of your patient and have them verify the labels to make sure that they are correct. Thank you.